Alpha blockers. Alpha blockers can be classified into non-selective drugs, alpha 1 selective and alpha 2 selective. Non-selective are further divided into reversible blockers such as phentolamine or irreversible blockers such as phenoxybenzamine. Alpha 1 selective drugs include prazosin, doxazosine, terazosin, and certain drugs which block the subtype of alpha 1 receptor, specifically alpha 1A, such as tamsulosin and alfuzosin. Alpha 2 selective blockers include juhimbine. Beta blockers. Beta blockers can be classified into non-selective drugs such as propranolol, nadolol, timolol, and pindolol. Beta 1 selective drugs, which are also called cardioselective beta blockers, such as atenolol, metoprolol, bisoprolol, betaxolol, and esmolol. They can be beta 2 selective blockers, such as butoxamine, or there can be beta blockers with additional cardiovascular properties, such as nebivolol, cartiolol, celiprolol, carvedilol, and labetalol. Non-selective beta blockers, being the oldest drugs, are also known as first generation beta blockers. Cardioselective beta blockers are also known as second generation beta blockers, and the new drugs with additional vasodilatory properties are also called third generation. Distinction question है कि what are third generation beta blockers? बीटा ब्लॉकर्स जो लेटेस्ट हमारे पास ड्रग्स हैं जिनमें कुछ एडिशनल कार्डियोवास्कुलर इफेक्ट्स हैं उनको हम थर्ड जनरेशन में क्लासिफाई करते हैं. क्यों? बिकॉज देव गॉट सम एडिशनल प्रॉपर्टी अदर देन द बीटा ब्लॉकिंग इफेक्ट. फॉर एग्जाम्पल labetalol, carvedilol, buxindilol, these drugs have alpha 1 receptor blockade activity in addition to the beta blockade. Similarly, celiprolol, nebivolol, cartiolol, bopindolol can cause increased production of nitric oxide and hence nitric oxide mediated vasodilation. There are certain drugs which have beta 2 agonist properties such as celiprolol, cartiolol, and bopindolol. Certain drugs which also cause blockade of calcium channels such as carvedilol, betaxolol, and vivantolol. There are certain drugs which cause opening of the potassium channels such as tilisolol, and drugs with antioxidant action such as carvedilol.